Now, if you look at a typical MRI, this is a professional footballer, post-ACL injury, you get this very typical set of bone bruises in the lateral femoral condyle and the posterior rim of the lateral tibial plateau. So here we've made a computer model and reassembled the knee in the posture when the bone bruises occurred. Here, you see the bone bruise are there. So if you've got, for example, something like an anterolateral ligament, how can that have remained unstretched during the ACL injury? I mean, my own feeling these days is getting stronger and stronger that there may be no such thing as an isolated ACL. So there's a thought for you. Whether that implies more surgery is for you to decide. So looking at the anterolateral structures, firstly, this is the anterolateral ligament crossing over the lateral collateral ligament here. It's a fairly weedy structure, which implies that it cannot take very large forces. It attaches to the femur just proximal and posterior to the epicondyle, and it dissipates into the periosteum of the tibia, midway between the head of the fibula and Gerdy's tubercle. Even though the ALL is a fairly weedy structure, nevertheless, it gives you a guide as to where you might put a reconstruction on the lateral side.